There has been many advances in cosmetic dentistry. The most significant advances are veneers, implants, and teeth whitening. There are so many patients out there who are so embarrassed of their smile, and the irony is that they're not even aware of the treatment options, which are easy, quick, and painless. We here at CareSoft Dental try to understand our patients' needs and address their concerns to help them smile with confidence. Most definitely, implants replace a missing tooth or teeth. Teeth whitening obviously whitens the teeth and gives you a brighter smile. And veneers beautify the existing tooth or teeth. They address problems like discolored teeth, chipped or uneven teeth, short teeth, spaces between the teeth, or even crowded teeth. The procedure is very simple. We first evaluate the patient's concerns, and depending on what we plan to correct, be it discolored teeth, chipped or uneven teeth, spacing or even crowding, we may or may not prepare the tooth surface. Even if we do prepare the teeth, it is very minimal, usually within the enamel, and hence does not require any kind of anesthesia or injection. Since veneers are a non-invasive treatment option, there is no pain or discomfort during the procedure. Exactly. The patients come back after 2 to 3 weeks and we cement the veneers permanently. We then bring the patient back after a week for a follow-up visit when we do the final finishing and polishing. It's that simple. The results are breathtaking and the patients are ecstatic because if their teeth were previously chipped or uneven, they are now straight and even. Any previous spaces are now closed. The discolored tooth or teeth are now lightened to match the rest of the teeth or to the desired shade. If they had crowded teeth, we have now aligned them perfectly like instant braces. This is a picture of a patient who had chipped her upper front teeth due to a chronic nail-biting habit. We made her 4 veneers to take care of these chipped teeth. We also made her an occlusal guard to wear during the day, and now she claims to be cured of a chronic nail-biting habit and is very pleased with the results. The next picture is that of a patient who was embarrassed of her uneven teeth and wanted a more beautiful smile. We first whitened all her teeth and then made her 6 veneers for the upper teeth to match the rest of her whitened teeth. She is now able to smile with confidence. This picture is that of a patient who was very conscious of the wire diastema or spaces between his 2 front teeth. We made him 2 veneers to close this gap or space. Now this is a picture of a patient who had a discolored tooth. We made him a veneer to match the rest of his teeth. He now has a very natural smile. In this next picture, we see a patient who had a very short teeth, which were chipped and uneven. He also had an old restoration on one of his front teeth that he was not very pleased with. We removed his old restoration and made him 4 veneers. This made his teeth a little longer and well aligned. This last picture is that of a patient who had crowded upper and lower teeth. She was debating between braces and veneers. After her comprehensive examination, I recommended veneers because she had a perfect posterior occlusion. Her only problem was her 6 front teeth, which were crowded. We first lightened her teeth at her request and then made her 12 veneers, 6 for the upper and 6 for the lower teeth. She was very pleased with the instant results, unlike traditional braces for which she would have taken more than a year. Almost anybody is an ideal candidate for veneers. The only concern, however, would be if a patient has parafunctional habits like nail biting, grinding or bruxing the teeth, biting on pen, pencil, nuts, ice, etc. Anything that would abuse or chip your teeth can chip the veneers too. Even these, though, can be overcome by fabricating an occlusal guard, which would protect the veneers and the rest of the teeth. Veneers would last a lifetime if they're taken care of. Patients should make a conscious effort not to abuse the veneers simply by wearing the occlusal guard if they have any parafunctional habits like grinding, nail biting, or even chewing on objects. Typically, there are no follow-up visits required. However, we do recommend seeing them twice a year for a checkup and cleaning, and making sure there's no abuse to the veneers and reinforcing the need to wear the occlusal guard if needed. We here at CareSoft Dental try to do our best one patient at a time. I do not believe in a waiting room swamped with patients. I make sure we my 100%. I listen to them and address their concerns. No patient should feel rushed here in my office. Good dentistry is an art taught in every dental school, but it is up to each dentist to practice it. At the end of the day, it is what makes you happy. For some, it's money, and for others, it could be fame or power. But for me personally, it is the pride and joy on a job well done. I believe in doing my job with honesty and perfection, giving it my best. With this beautiful, state-of-the-art dental practice, which is completely chartless, so the patient's records are just a click away. We have digital x-rays, which are very diagnostic, and a patient educating system which answers all your concerns and questions. We use a laser cavity detector, the Diagnodent, which detects cavities at the early stage, so we can restore it even without anesthesia. This comes in very handy with kids and some adults who are needle phobic. We also use the intraoral camera, which allows you to see what I see. But not the least, an online patient scheduling and communication via email is so preferred. We also have in-house specialists to make it more convenient for our patients. To learn more about us, please visit us at www.caresoftdental.com.